Shall we start, madam?
Yes, sir. That's right.
Om Shri Gurubhyo Namaha. With the blessings of Lord Dhanvantari and with the blessings of Shri Guru Mahanta Swamiji, let's start today's program. A very good morning to one and all, and very warm welcome to all. Myself, Dr. Vishwaradya Hiramat, Assistant Professor, Department of Kumara, SVM, Ayurveda Medical College, Ilkal. Welcomes you all for Kumara Bharana 2020 lecture series. Today we have with us an eminent speaker, Dr.Bharati Tiwari madam. Before starting the session, I would like to request Dr. Mukta madam to introduce today's guest speaker. Over to you, madam.
One and all.
Hello. Yes, ma'am.
Morning, one and all. And I would like to take the pleasure of introducing today's guest speaker, Dr. Bharati madam. So, Dr. Bharati Tiwari madam completed her PAMS from Sushruta Ayurvedic Medical College, Bengaluru, and MD from Rani Dulia Ayurvedic Medical College and Hospital, Bhopal, Madhya Pradesh. Madam also completed her yoga instructor course. And Madam presently working as an assistant professor in the Department of Kumara at Jeevan Jyoti Ayurvedic College, Aligarh, UP. So we are happy to have you with us, Madam. And just before we begin, there are instructions to the participants. Please display your full name, mute your audio while joining the session. And if any queries, they can be dropped in the chat box, which will be discussed at the end of the session. In case of any disruption, please wait patiently until resume of network connectivity. Now I would like to request Dr. Bharati madam to carry forward this webinar and give her insight on the topic, role of breastfeeding in neonate. Thank you. Please, ma'am.
Yes, ma'am. Yes, ma'am. Thank you, ma'am. And very good morning to Mukta ma'am and sir and all teachers and my dear students. And thank you, sir, for such a nice introduction and madam too. So today my topic is role of breastfeeding in neonates. So as all of you know that exclusive breastfeeding is very important for babies because it is the basic food for babies which fulfill the nutrients, provide a caring environment, make a beautiful bond between child and mother. So it is a complete food and it is also complete of all nutrients and which provide good growth and development for baby. So for normal growth and development baby, from the time of birth to should we start and first 6 months, from time of birth to 6 months. And after that, we can start weaning along with that. But we should not stop feeding immediately because that time baby will not get satisfied when we feed or when we introduce with the food. So it is also very important for mother to feed the baby because breastfeeding can reduce chance of postpartum hemorrhage, engorgement of breast, carcinoma, etc. So it creates a beautiful bond between mother and child. So it is very important for both. If mother will not feed, she will get disease. If child will not take a proper feeding, that time the child may malnourished, will not attain a proper growth and development. So next slide, please. So according to it, this is the data. So according to universal epidemiology on breastfeeding, it prevents 8,23,000 annual deaths in children younger than 5 years and 20,000 annual deaths of mother from breast carcinoma. As I told you, if mother will not feed baby, she will suffer with a carcinoma also. So Government of India has launched a national breastfeeding program called as MAA, means Mother's Absolute Affection, to ensure adequate awareness is generated among masses, especially mothers, on the benefit of breastfeeding. So that's why this is the data which is given by the government, and government has launched a program. So when the mother is on breastfeeding, we should also counsel and we should tell how, the techniques and all everything. The next slide, please. So the next one is formation of pistachia or breast milk, or in this we can see the physiology also. So according to Ayurveda, like many, according to is formed from rasa or rasa prasad bhaga, which is called as bodily fluid. And according to Acharya Kashyapa, he is also mentioned that formation of pistachia from rasa during the pregnancy period. Third, next slide, please. Breast milk is produced due to interaction between hormones and reflexes. So we should know what are all the hormones which are responsible for the lactation or which help in lactation. So during pregnancy, the glandular tissue of breast milk is stimulated to produce milk due to hormone oxytocin and prolactin. So here I written that due to various hormonal influence. So various hormonal means the two hormones, prolactin and oxytocin. The suckling stimulus on the nipple of breast causes signals to be transmitted through sensory nerve to the hypothalamus, which causes release of prolactin and oxytocin from the pituitary gland. So prolactin is produced by anterior pituitary gland and responsible for milk secretion by alveolar cell of breast. And when baby sucks, the nerve ending in the nipple carry passes to anterior pituitary, which in turn release prolactin. And oxytocin produced by posterior pituitary gland is responsible for contraction of breast tissue leading to ejection of milk from the gland into the lactoferin sinuses and duct. And this hormone is produced in response to stimulation of nerve ending in the nipple by suckling as well as by the cord, sight or sound of the baby. Am I too fast?
No, madam, no, it's okay.
It's okay, sir?
Madam.
No, if I'm not too fast, so I will like this is my speed, so that's why. So these hormones are then carried by blood in the breast, where it promotes secretion of milk and concentration of myoepithelial cells of mammary gland, leading to ejection of the milk from the gland. So these hormones are carried from blood. In less than a minute after the beginning of suckling, milk begins to flow. Here, you can see in a slide the image. Sir, next slide, please. In this slide, you can see clearly that how the hormones are working, how prolactin and oxytocin are working. Like prolactin in blood when baby sucks that, and the sensory nerve impulse get and the lactation will start. And oxytocin, how by the touch or sound or sight of the baby, like previous slide I told you, it creates a beautiful bond between child and mother. So this love and affection will help to produce a milk or help in lactation or ejection. The next slide, please. Now we should know what are the causes for stanya pravritti and apravritti. So Acharya Shushruta clearly enumerated factors which result for milk ejection as thought, sight, or touch, as well as physical contact of the child. But affection for the child is mainly responsible. You have seen in the previous slide that how these hormones are working. So the more the baby sucks at the breast, the greater is the stimulus for milk production. And on third or fourth day after delivery, milk ejection starts. It is especially interesting that fondling of the baby by the mother or hearing the baby crying often gives enough of an emotional signal to the hypothalamus to cause a milk ejection. So it is clear that hypothalamus they get the signal, and that time only the lactation will start or rejection. So next slide, please. Many psychogenic factors are also playing a role. Psychogenic means when mother will be having any type of tension or any type of stress, or she will be in a pain or fear. That time also, it will affect on this period, means the lactation time. It will reduce the lactation. So psychogenic factors can inhibit oxytocin secretion and consequently depress milk ejection. So the prolactin, or we can say milk secretion reflex. So prolactin milk secretion reflex, enhancing factors like sucking, expression of milk, emptying of breast, night feeds. This prolactin work more in night. So night feed is that time that this hormone is secreted. So what are the hindering factors? The hindering factors are incorrect position, painful stress, relactal feed, top feeding, and oxytocin or milk ejection reflex. So enhancing factors are loving of baby, sound of baby, sight of baby, mother is relaxed, comfortable, confident, and hindering factor are worry, stress, pain, and doubt. So these are the factors which can affect the lactation or ejection. Now, the characteristic of milk or Stanley Sampad. Before that, I just give a little information about the Istana Sampat. Istana Sampat means ideal breast. Ideal, how ideal breast should be. So, in Kashyap Samhita, they told or acharyas told that na ati stana should be na ati urdhva, na ati lambha, na ati krisha, and have appropriate nipple. Means appropriate nipple means size and shape and the position, everything. So because this urdhva stana and lambha stana make the child karala danta. It can affect in teething also. And urdhva aksha means upward looking. So if the istana will be urdhva, ati lamba, so that time the child may having habit of upward looking and cover the face and nose, which may result in death. Means that if size of breast will be big, that it may cause baby's death or baby can get asphyxia. So now the Stanya Sampat, so characteristic of normal breast milk. So according to Acharya Charaka, the milk which is normal in color, smell, taste, and touch, mixed evenly when poured into water, is known as a pure milk. So Acharya Charaka says this if the milk is having these type of characteristics, then it is a pure milk, and it provides nourishment, pustikara, and arogya for the child. According to Acharya Shushruta, he described that sheet, clean, free from impurities, shankhava, sweet in taste, mixes evenly in water, not producing any froth or streak when mixes in water. So this is according to Shushruta. Shankhava is nothing but the color. They told like Shankhava color. How the Shankha is colored? It is pure white, like that the milk should be. This and this type of milk provide good health, growth and development of body, strength to the body. Means if baby will feed properly, so it will help for the proper growth and development. So next slide, please. Now, what are the composition of the breast milk or components that are present in breast milk? So more than thousands of proteins, amino acids, oligosaccharides, more than 40 enzymes, growth factors, hormones, vitamin and minerals, antibodies, long chain fatty acids, and 1400 micro RNAs and millions of live cells. So these are the compositions of the breast milk. But these components are present in breast milk. Next is a type of milk. So, five type of milks are there, like uh, colostrum, translational milk, mature milk, core milk, hind milk. So, first we should know what is colostrum. So next slide, please. In next slide, colostrum, it is secreted first 3 days after delivery. It is the first milk, and it is thick yellow in color and secreted in a small quantity. So it contains antibodies and cell in higher amount and protein, fat soluble vitamin A, D, E, and K. The next slide. And colostrum is also referred or known as a natural vaccine because its level of antibodies and white cells are so high. That's why the child is getting a natural immunity from mother when the child is on breastfeeding. So this colostrum is also very important, which is secreted in first 3 days of the delivery. And colostrum also having protective qualities and also important for babies' digestive system because babies are born with a permeable gut lining, which colostrum coats and seals. So, gut lining is what? Whenever the baby is feed, how the baby will get the nutrition from the intestine. If that gut lining will be not very good, that time that the nourishment will not get the child and maybe baby in malnutrition. So it's also rich in minerals and vitamins with higher concentration of vitamin A, D, E, and K. And percentage of protein is also very high. And cholesterol is also act like laxative that helps babies pass the first urine and meconium. So meconium is what the first stool of the baby, and it is green in color. So can you go in a previous slide like types of milk and types of milk? Hello.
Hello, madam. Hello.
So the previous slide, so the types of milk, sir.
Yes, madam. That slide only is showing.
Yeah.
Uh,
Okay, sir. Thank you. So next one is a transitional milk. Or transitional milk is it is the milk secreted during the next 2 weeks of the postnatal period, and it contains immunoglobulin and protein contents are decreases in there, and while fat and sugar is increased. So in this immunoglobulin and protein contents are decreases and fat and sugar are increased. Next is a mature milk. So mature milk 4 weeks onward and contain all nutrients for optimal growth of the baby. So it is watery, thinner, and having all nutrients. Now fore milk. So fore milk is more watery and it is just for the satisfaction for the baby, means for a baby's thirst. That's it, nothing else. And it contains protein, sugar, vitamin, and mineral. And hind milk, it comes later toward the end of the feed and is rich in fat and energy and satisfies the baby's hunger. So the breastfeed should be till 6 months, are exclusive breastfeeding because babies are getting nourishment or vitamin or mineral everything from the mother milk. So now next slide, sir. That table. Here you can see in a table where I shown the colostrum and mature milk and energy in kilocalories, how much. So a total protein is 2.3 gram and in mature milk 0.9 gram. Ig is 364 mg and in that 142. So it shows that colostrum is having a rich nutrients, vitamins on it. So next slide, please. So, the breastfeeding technique. Technique is also playing an important role. If mother will not know the technique, she may feed the baby in a wrong way. So mothers should be demonstrated about the techniques of breastfeeding, and mothers should be advised for exclusive breastfeeding up to 6 months as demand feeding. Demand feeding means not should like that we should feed baby in every half an hour or in every 1 hour. When baby is demanding, how we can know that baby is demanding? Because after complete feed, baby will sleep for 2 hours and 3 hours, and after that baby will cry. That time we can know that baby is hunger. So that time only we can feed. And one time one breast, next time second breast. Not like always one breast should be in every feed. So here, before feeding, mother should take bath and wearing clean garments. And Acharya Charaka also mentioned that breastfeeding start on first day. You can you can read in this Navata Shishu culture or in Ahar Vidhan. There they told that very first day should feed the baby from Dakshina Istana or right side of the breast. But first give madhu plus sardi for lick, then give for breastfeeding. And according to Acharya Shrishruta and Ashtanga, first Ananta Mishrit Madhu Sarti 3 times a day, then second and third day Lakshmana Siddha Grit 3 times a day, and fourth day handful Grita and Madhu was given, and after that breastfeeding start from right side of the breast. So both the acharyas they told should feed from right side of the breast. But there's a difference in Acharya Charaka and Acharya Shushruta and Ashtanga. So Acharya Shushruta also describes as proper bathing of child and washing of breast, as well as expressing out a small quantity of milk, chanting the given mantra, breastfeeding, then breastfeeding is done. And similar description is given by the Vagbhata also. Acharya Vagbhata has given the similar description. So next slide, please. So in present era, more stress for breastfeeding given because of numerous benefits to child and mother. So what are the benefits we should know for child and mother? So after normal delivery, breastfeeding should be initiated within first half an hour to 1 hour of birth as soon as possible, and after 3 to 4 hours in cesarean section. So baby should be put on the breast as soon as the mother has recovered from labor, preferably within an hour after birth. So why in cesarean section after 3 to 4 hours the breastfeed? Because that time mother will be having some anesthetic effect on her body. That's why after 3 to 4 hours we can give for feed for baby, because if baby feed that time, maybe baby will having some effect of anesthesia. So in cesarean section, 3 to 4 hours. This also helps mother to establish a bond with her baby and to promote lactation. So mother should sit up comfortably and keep the baby's head slightly raised and offer alternate rest at each feet. And position is also very important. So proper position of the baby while breastfeeding, include supporting whole of baby's body, ensure baby's head, neck, and back are in the same plane. Entire baby's body should face mother. Baby's abdomen touches mother's abdomen. So this position should mother take, otherwise baby will not feed properly, and that mother will get a pain while feeding. So next slide, please. So attachments means good sign of good attachment and sign of bad attachment. You should know that baby is latching the breast properly or not. So after proper positioning, the baby's cheek is touched with the nipple. Due to rooting reflex, here rooting reflex and sucking reflex are playing a main role. So voting reflex, baby quickly turns his face toward the breast and starts sucking. So we should also come to know that these two reflexes are proper, because in preterm babies you will not find these reflexes as very good, voting and sucking, because they are preterm or immature. So the baby should be latched onto the breast, ensuring that the nipple and most of the alveoli are within baby's mouth. So baby's mouth should be wide open, lower lip turned outward, baby's chin touches mother's breast, and majority of alveoli inside baby's mouth. So it is the good sign of attachment. For effective sucking, the baby must form an effective seal around the nipple and alveolar to eject the milk from lactal. And proper attachment is indeed the key of successful breastfeeding, and both the nipple and areola must be effectively grasped by the baby. If the baby sucks only at the nipple, the milk is not ejected. So this is a bad sign. Or bad sign attachment is what on when the baby sucks only the nipple from mouth, not alveolar, or suckling with a poor attachment may uncomfortable for painful for the mother also. So this is the bad sign of attachment. Next slide, sir. Ah. Now we should know what are the positions that mother should take. So, laid back, breastfeeding or reclined position, cradle hold, cross cradle hold, roti ball hold, sideline position, laid back breastfeeding after a C-section, upright breastfeeding, dangle feeding, nursing in a sling, double rugby ball hold, dancer and nursing position. So these are the positions that mother should take. In the next slide, please. In next slide, you can see some of the pictures I had shown to you. That cradle, cross cradle, back line position, sideline cradle, side line position. So these are the some of the position that mother should take while feeding. So next slide, please. Now, what are the precautions that mother should take while feeding? During early days, most of the babies fall asleep after a few sucks or kept asleep for many hours. So baby should be aroused by gentle tickling behind the ear or on the sole. But this act should not be unpleasant to baby. Means we should not give a very strong tickle to baby. It may hurt. So we should give a very gentle tickling to that time baby, because baby fall asleep while feeding. The baby must be satisfied for at least 2 hours before he starts crying for next to feed. As I told you before, that if when baby feeds completely, the stomach will be full. That time the baby will get a good sleep, a sound sleep, and baby will not cry. To safeguard against regurgitation after each feed, birthing of the baby is advised. It is very important to give a birth, because when a baby feeds, that time while feeding, uh, baby may swallow air with milk. So it may irritate the baby, or distension of the baby can get pain in abdomen. So burping is very important that we can advise. And baby should be fed on demand and not by clock, as I told you before. There is no additional requirement of water to a breast to feed baby. Why? Because this milk is complete for the baby. No need of water, no need of juice, nothing. That only that milk is sufficient for the baby. The next slide, please. Exclusive breastfeeding is defined as an infant consumption of human milk with no supplementation of any type, no water, no juice, no human milk and no except for vitamin, mineral, and medication. Medication, what that may sometimes baby get disease, that time we can give medication. And if baby needs extra vitamin and mineral, that time we can give like in ill time. Next is bottle feed use should be avoided because it also leads to nipple confusion and result in the diffusion for breastfeeding. There is also possibility of contamination and development of infections due to use of bottle feed. So bottle feed is nothing but this. It is an artificial technique that mothers can use where mother is not lactating properly. So that bottle feed is full of contamination because it will not follow proper hygienic technique or not proper follow the hygiene. That is, that bottle will having contamination, and then if we pour milk on that and if we feed baby, so through milk that infection can goes into the baby's body and baby will fall ill. Generally, it is agreed that exclusive breastfeeding for first 6 months is sufficient to support the normal growth of baby breastfeeding. The breastfeeding should be instituted from the starting, and no water, glucose, water, tea, etc. should be given at that time. Comes to contraindication. This is also very important. We should know what are the contraindications. So, women who give and that when we not additional are not good for the breast. Components are accessibility, farming, and resulting consumption of diet without fat or
તમે જે નંબર ડાયલ કર્યો છે તે હાલમાં વ્યસ્ત છે. કૃપા કરી થોડા સમય પછી.
hello. Hello.
Hello, madam.
Audible, sir?
Yes, madam. Yes, it's audible.
Okay. So this slide I had explained, no? That time connection was there or not, sir? Should I explain again?
No, sir. No, madam.
It's okay. So next slide, sir.
Okay, madam.
So next is Kala or weaning period. Weaning period is that when we introduce the baby from breastfeeding to solid food or the food when we introducing the food. Like Kashyapa has told, in 6 months we should give do Palaprashna, and in 10th month we should do Annaprashna. So there is this is the weaning period where we can introduce a baby to solid food. We should not introduce immediately a solid food. First, we should give a liquid, then semi-solid, then solid. So Acharya Bharata told that gradual weaning should be done after erection of teeth and child should be given goat or cow's milk with a light and Brahmana diet. So here artificial milk is all like artificial milk means the other milk, other than the breastfeeding. So स्तन्य अपनयन विधि, as I told you in Ayurvedic test, you can get in your Kumara result. Is a transition period in which solid and stable food replace the milk or formula. Between 6 and 12 months of age, after the baby becomes familiar to solid food and liquids by bottle and or cup, most infant babies breastfeeding. And breeding begins at 6 months of age. In the beginning, introduce one food at a time, while milk should continue to 2 months and gradually formula or cow's milk is then substituted. So, while introducing solid food, encourage a cup rather than a bottle because water is a like very unhygienic when we not boil that bottle completely, that the milk will stick inside that and the bacteria can be released. So if instead of bottle, always we should use cup or a glass or a dairy chemist. The next slide, please. Now, what are the benefits to mother? So, mother as well as child both. So, first we should know what are the benefits. Previously, I told if mother will feed properly, she will free from the diseases like so here we can see what are the other benefits also. So breastfeeding is convenient and less time consuming. Milk is readily available all the time at the desired temperature. Desired temperature means normal temperature. What there is no need to buy feeding bottle artificial milk, and no time is wasted for bottle and preparation of feed. So see that mother milk is properly like hygiene, it's full of sterilization, and it doesn't contain any unhygienic or any type of infection. So women breastfeed infants and less cavity and more immunity than the breastfeed their infant as told by various studies. So here you can see very clearly that bond. So if you feed baby by bottle feeding, you will not be having that attachment to the baby like you are having when the mother will feed from breast or exclusive breastfeeding. So it is clear to you in various studies it is proved. And breastfeeding after birth provides protection against pregnancy due to lactational. The next slide, please. Hello. Hello. Yes, sir. Thank you.
Hello, madam.
Despite amenorrhea who knows yes, the voice is coming now, sir. Am I audible?
Madam, slight disturbance is.
Hello, am I audible, sir?
Madam, in audio, slight disturbance is there, madam.
Slight disturbance.
Madam.
Okay, just wait, sir. Now, sir? Now is it okay?
Now it's okay, madam. Little bit.
That's okay. Okay. Thank you, sir. So, women remained amenorrheic who nursed frequently during exclusive breastfeeding longer than infrequent nurses introduced supplements later and did not retain lactose from thereafter. And decreases in postpartum weight retention also noticed after engaging prolonged breastfeeding. Some of the women they are not feeding babies properly. Why? Because they are very cautious about their figure, weight gaining. That's why. So most of the ladies they refuse to feed, and they depend upon the wet nurse or diamer or bottle feed. So long duration, so that time that this deep benefits the mother will not get. And long duration of lactation was associated with a reduced risk of coronary heart disease. There are increased risk of vascular changes associated with future cardiovascular diseases in mothers who do not breastfeed their and mothers who breastfeed their baby have a reduced risk of breast cancer, ovarian cancer, because they are feeding. And if baby will not, and if mother will not take, that time they may get ill or they may get coronary heart disease. And long-term breastfeeding, but not OC users, was associated with significant reduction in the risk of heart. So next slide, please. So these are the benefits of mother. Now we have come to know that what are the benefits for child. So breast milk provides both immediate and long-term benefit to infant. And breast milk is free, reducing or eliminating the cost of formula. The breast milk is optimal food for almost all infants in the first year of life. Colostrum is known to contain antibodies called immunoglobulin such as IgA, IgG, IgM, and when in previous slide, when I told you about the types of milk that time, I described about the colostrum. So that's why colostrum is very important because it is rich of nutrients, immunoglobulins are present, and it can protect from infection to baby because through this the baby can get a natural immunity from it. Other immune components of colostrum include the major components of innate immune system such as lactoferin, lysozyme, lactoperoxidase, complement and proline-rich polypeptide. These bioactive agents, which are not found in commercially prepared formula, boost the infant's immature immune system. So, if baby will be in an artificial feed, these nutrients or these components will not get in cow's milk or buffalo milk or goat milk. So that's why this breastfeeding is having a very important role or having a good benefit to child. So next slide, please. Now, breast milk contain about 3.5 gram of fat per 100 ml of milk. Breast milk fat contain long-chain polysaturated fatty acid or DHA and an arachidonic acid like ARA that are not available in other milk. As I told you before that these are not present in other milk. These fatty acids are important for the neurological development of a child. So this is very important. So these components are not in artificial milk. That's why this it is not good for the child. Now DHA and the ARA are added to some varieties of infant formula, but this does not confer any advantage over breast milk and may not be as effective as those in breast milk. Lipase in milk improves digestion by supplying readily available free fatty acid to infants. The main carbohydrate is the special milk sugar lactose disaccharide, and breast milk contain about 7 gram lactose per 100 ml, which is more than in most other milk and is another important source of energy. Secondly, high lactose content enhanced calcium and iron retention. So calcium is also very important for the baby because it promotes the bony growth and iron. So this calcium, iron, and everything we are getting from the mother milk, and it is not present in artificial milk. So that time what if mother is on, if baby is on artificial feeding, that time we should give supplements like calcium supplements or iron supplements to baby for the proper growth and development, proper body growth and like in deficiency, iron deficiency, etc. So next slide, please. Breast milk contains a balance of amino acids which are suitable for babies. This is one of the composition which is present in breast milk. So the concentration of protein in breast milk is 0.9 gram per is lower than in animal milk. The much higher protein in animal milk can overload the infant's immature kidney with waste nitrogen products. Breast milk contains less of the protein protein. It forms from softer, more easily digested fluid than that in other milk. So the artificial milk like cow's milk and other milk or formula, they having the high protein content, so they are very heavy to digest to baby. That when the baby is on the artificial feeding, that time when we give these milk, all we should always dilute the milk. Then we should give for feed. Next, human milk contain more alpha-lactalbumin. Cow milk contains beta-lactoglobulin, which is absent from human milk, and to which infant can become intolerant. So, that's called as lactose intolerance. Lactose intolerance means what? Like when baby is having allergy from milk, or baby is feeling difficulty in digestion when the baby is taking milk. So many neonates also or infants also is having this problem, that intolerance. The next slide, please. Breast milk normally contains sufficient vitamin for an infant unless the mother herself is deficient. The minerals, iron, and zinc are present in relatively low concentration, but their bioavailability and absorption is high, provided that maternal iron status is adequate. Infants are born with a store of iron to supply their needs. So only infants born with low birth weight. So next slide, please. So exclusive breastfeeding for 4 or more months appear to diminish the risk of respiratory hospitalization. So this is a benefit where if the baby is having baby is in exclusive breastfeeding, the baby will not fall ill. Baby will not get any respiratory diseases or diarrheal disease or any type of infection. So there is a less chance of hospitalization. Exclusive breastfeeding for 4 or more months protects the infant from single and recurrent episode of otitis media. Otitis media is nothing but it is an infection of the ear. Exclusive breastfeeding also results in protection against diarrhea, specific morbidity and mortality throughout the first 2 years of life disease, even in infants aged more than 6 months. As I told you that if baby is having good breastfeeding, so baby is free from disease. The next slide, please. Human milk oligosaccharides are clinically relevant to protection against infant diarrhea. Molecular of the human milk inhibit the addition of common pathogens like E. coli, as well as the first time of other aggressive bacteria, Vibrio cholera, and Salmonella virus. Breastfeeding results in prevention in gastrointestinal infection as low pH, low volatile fatty acids, and high lactic acid concentration make the following. It also reduces the risk of acquiring UTI infection after birth. And breastfeeding have half the risk of sudden infant death syndrome in children to the age of 1. So it is clearly indicated that baby is getting nutrition, so baby will be healthy. So next slide, please. Thank you, sir. There is evidence that breastfeeding for at least 4 months compared with feeding formula made with intact cow milk protein prevents or delays the occurrence of atopic dermatitis, cow milk allergy, and wheezing in early childhood. And it associated with a reduction in childhood obesity risk. Children who were never breastfed or who stopped breastfeeding before the age of 4 months introducing solid food before the age of 4 months was named. So next slide, please. The practice of breastfeeding results in higher cognitive level activity and provides evidence that prolonged and exclusive breastfeeding improves children's cognitive development. So it is a development, growth and development. This is one of the development. Breastfeeding breastfeeding also helpful in slight prevention of childhood acute leukemia and lymphoma. Study results suggested that children who are never breastfed or are breastfed short term have a higher risk than those breastfed for more than 6 months of developing Hodgkin's disease. So next slide, please. Now, this is the substitute, or we can say like artificial feeding also. So, what are the substitutes? In Ayurvedic text, their description about the substitute milk in case of non-availability of milk of mother or wet nurse. So, here the wet nurse role is very important because when mother is not feeding, or sometimes what happens when mother gives a delivery and soon after delivery mother will die. So that time the baby will not get a mother milk. So that wet nurse is having a very good role. In Kashyap Samhita, like especially enumerated one chapter, Dhatri Prakarana. So in Dhatri Prakarana, you will get how Dhatri should be and how she should feed and what are the other requirements. And according to Acharya Shriputta, he advised that when mother or wet nurse is unable to feed, they should give nutrition and dose of diet should be given appropriate until the mother or wet nurse does not regain sufficient milk or else till the child cannot thrive properly without milk. So next slide, please. So Acharya Bharati advised that goat or cow's milk should be given to the child after medicating. Means we should not give directly that milk. So how we medicate with a decoction of laghu-panchmoola and mixed with the sugar. So sugar is using for a taste, so baby can take easily. There are several nutritional, physiological, and biochemical differences between the human and cow's milk. The way protein in human milk is easily digestible and human milk lipase promotes fat digestion. So the nutrients available in the human milk are more readily absorbed and better utilized due to higher biological efficacy. So our acharyas are also told about the substitute, and when we use the substitute, how we should use. We should not give directly that artificial milk or the formula. So next slide, please. So antibodies that are in breast milk are not in cow's milk or formula and cannot be artificially produced. The amount of protein in cow's milk or formula is double the amount in breast milk and is also different and less digestible. Previously, I told you that cow's milk is having more protein and it is heavy to digest for the baby. So it overloaded on protein. That's why we should always dilute. The cow's milk or formula has a smaller amount of carbohydrate than breast milk. The fat in cow's milk or formula is very different than the fat in breast milk and digestibility is poor. So it is very clearly shown that breast milk is very good and artificial milk is not good for you. Ayurvedic classics, it is clear advice that if a child is given breast milk of different women or lactating women is frequently changed, then the child suffers from lactation. So I think what are all the drugs that we can use in our classics, it is very explained very well. Here some of the formulas I like to share to you that Acharya described various formulation in case of his and diet also like cereal, wheat, cow milk, sugar, curd, we can use in Stanyaksha. And mother should be happy and absence of sorrow, anger, fear, avoid of excessive working because this can affect in Stanya Nasa or Stanyakshaya. So Stanya Janana Dravya we can use distilled tila, and fish, Singajaka, Vidari Kanna, Madhuka, Laghu also is used to ferment. And Shatavari crystalled with milk. So Shatavari is good for producing milk, or it helps in lactation. So the conclusion is that what we how the lactation is occurred, it is totally based upon the bond between the mother and the child. So as the mother will feed the baby, mother will also feed from disease, and if the baby feed properly, the baby will also feed from disease. Baby will not malnourish. Baby will get all the nutrition from mother, whatever the baby's requirement, it can fulfill by breastfeed. So that's why this breastfeeding is having an important role in infant, or that benefit to mother as well as child. Thank you. Thank you, sir.
Hello, madam. Hello.
Yes, sir. Yes, sir.
Madam. Thank you very much, madam.
Hello. Yes, sir.
Thank you very much, madam, for your informative
Yes, sir.
presentation. And I would like to ask all the participants.
Any queries, sir?
If you have any queries, you can directly ask madam, or you can put in chat box so that madam will clarify.
If anybody is having a question, please ask. I think so. No queries. Students are satisfied.
Yes, madam. I think no queries, madam. This topic is very relevant, madam. That too
Yes,
in this month.
and it is very interesting topic. I can explain more on that, but that is sufficient. Like it tells about the importance or role of breastfeeding.
Yes, madam. Actually, breast milk is species specific.
Yes, sir.
And the nowadays um, the many infant formulas are there, and
Yes,
they have
sir.
developed. And even
Yes.
though they are closed to the composition is very close to the breast milk as such, but the acceptance, most of the what I have seen practice, acceptance as a breast milk, the formula feed is that is not that much, madam.
Yes, sir.
And
And
compared to
like
breast
nowadays in
breast milk.
market also you will get the breast milk, because the mother who are lactating more, they store that milk in a sterilized bottle kept in a fridge and supply
Yes,
to the
madam.
market. So the babies who are not getting the breast milk due to any lacking, or mother will be not there, or maybe lactation problem is there, that time baby is getting a milk from market itself.
Yes,
The
madam.
breast
That's why
milk.
the concept of breast milk banking is there.
Yes,
That
sir. Yeah,
should
breast milk banking.
initiate everywhere, madam. That
Yes, sir.
concept. And
Yes, sir.
yes, madam. Thank you, madam. Thank you very much
Thank you so much, sir.
for your
Sir, can I get
presentation.
this recording in my mail, sir?
Yes, madam. You can get, madam.
Yeah.
Sure.
Okay, sir. Thank you, sir.
Okay.
Thank you, students. Have a nice day. Have a nice day, sir.
Thank you, madam. On behalf of our institution and Department of Commerce, we thank you, madam. Thank you very much. And I also thank all the participants for their patient listening.
Yes.
And with the continuation of the Kumara Bharana 2020,
Yes, sir.
tomorrow, that is on 25th of August 2020, 11:30, the next lecture on Samskaras in relation to growth and development by Professor Shambhu Dayal Sharma, Professor and HOD Department of Komarabhritya, Sri Krishna Government Ayurvedic College, Kurukshetra. Thank you one and all. I request all the participants stay tuned with us tomorrow also as you did today. Thank you one and all.
Thank you, sir.
Thank you, madam. Thank you. Thank you.
Okay, sir. Thank you, sir. Bye, sir.